Bruce Millray here at the True North Health Center in Santa Rosa, California. This will be Mindy's and my last day here. It's been a life-changing experience. Mindy completed 5 days of water-only fasting and then 3 days of juice. I did 8 days of water-only fasting followed by a day of juice, then raw food, then steamed food, and now I'm going back to my standard whole food, plant-based diet without any salt, oil, or sugar. If you are struggling with a chronic disease and you're searching for answers, I really encourage you to connect with the True North Health Center. And I had a chance to do an interview with Dr. Alan Goldhamer. He's the founder and director here of this foundation. And it's about 15 minutes long. I encourage you to listen to the whole thing. He gets right to the point about exactly what they do, the scientific evidence behind it, and the type of results that you can expect if you decide to take this path. Mindy and I are here at the True North Health Center with Dr. Alan Goldhamer, founder and the main person running the True North Health Center. Thank you for having us today.
Pleasure.
And I have an intake tomorrow with some of Dr. Goldhamer's team, and we're going to discuss some different approaches to augment my battle with prostate cancer. Dr. Goldhamer, if you just give us a quick overview of True North Health Center, how it got started, and what you're doing.
Well, sure. You know, we've been here since 1984, so for the last 34 years, we've been operating this residential health education program, which specializes in using a whole plant food diet that avoids salt, oil, and sugar. And we also utilize medically supervised water-only fasting, which is probably the most unique thing we do, where people come in and spend anywhere from 5 to 40 days on water only. And the idea is to give the body a chance to do what it does best, and that's heal itself. So patients are evaluated. If their condition is appropriate and likely to be responsive, they'll come and stay with us. They'll go through fasting where they're monitored carefully. We have an intense educational program that they do while they're here to teach them about how to eat, how to use their bodies, the importance of sleep, rest, meditation, exercise, etc. And then we expect them to go home, implement those changes so that we get a good long-term outcome.
How's the success rate?
Well, for the conditions we treat, it's very good, but we tend to treat conditions that respond to this type of approach. And the conditions that respond to this type of approach are conditions that are oftentimes made worse by dietary excess. So conditions like high blood pressure and related cardiovascular disease, type 2 diabetes, autoimmune diseases like rheumatoid and osteoarthritis, ulcerative colitis, ankylosing spondylitis, asthma, eczema, psoriasis, those types of conditions.
A wide range of conditions.
We also have been recently treating a large number of patients with lymphoma. So those conditions, those chronic diseases kind of the modern era represent maybe between 70 and 85% of the conditions that people are suffering from. So that's pretty much what we limit our focus to. Conditions that wouldn't respond to this type of approach, we tend not to treat. So of the conditions that we treat, the results are very good. For example, we have a study we published with T. Colin Campbell from Cornell University it's called medically supervised water-only fasting in the treatment of hypertension. We took 174 consecutive patients with high blood pressure, and all 174 were able to eliminate their need for medication. We have the largest effect size that's ever been shown in treating high blood pressure in humans, with an average drop of 60 points in stage 3 hypertension.
Which is better than any drug.
Well, it's dramatically better than any combination of medication. On average, drop systolic blood pressure an average of about 12 points. So it's a significantly more effective way of managing high blood pressure in people willing to do dangerous and radical things like eat well and exercise and go to bed on time, as well as fasting.
Well, so do you see progress as far as this information getting out to the public? Mindy and I, we're dedicated to just getting the information out, and we know people like yourself and luminaries in the evidence-based medicine movement want it to happen. Is it getting better?
Well, I think it is dramatically because in large part to things like the internet. The fact that webinars can now get, when we used to speak publicly to 100 people, now it might be 100,000 people that view.
Yeah.
Movies like What the Health and others that have gained popular success through Netflix, where millions of people have, been able to observe a message that in the past you just couldn't do. We have a newsletter that we send out to 26,000 subscribers. Well, in the past, just to mail a hard copy to 26,000 people would have been a big financial burden, whereas now it's a relatively simple process. So the ability to get information out is dramatically more effective and efficient. than it might have been in the past. And, you know, we see the effect on the census at the True North Health Center. You know, we're booking October right now, so several months in advance, despite the fact that we've continued to grow the facility. So definitely there's more interest, there's more awareness, there's more ability to get information out. But there's also more confounding information competing with the truth. I noticed that there was accusations made about the What the Health movie, that the people in it, many of which were filmed, patients at the center, were supposedly all paid actors, and it was all phony and stuff. So I mean, you know, there's actually like active disinformation that seems to be going on.
It's incredible.
Yeah, that's
it's incredible.
Kind of humorous, actually.
Is diabetes curable?
I don't think diabetes is curable. I don't think obesity is curable. I don't think high blood pressure is curable. I don't think anything's curable. What these conditions are all manageable. For example, with obesity, if you lose the weight and you go back to eating greasy, fatty, processed foods, you're going to get fat again. So you can't cure it. You can just manage it. If you get rid of the cause of the problem tends to resolve. But if you go back to doing the things that cause it, it's coming back. High blood pressure, we can normalize your blood pressure, keep it down the rest of your life. But if you go back to the higher salt, higher fat, poor habits that cause the problem, it's coming back. It's not.
That's a good way.
Cure.
I like.
So I think that the only real cure, particularly when we're talking about something like cancer, is prevention. Once you have a condition, it's management. Now, can you manage the conditions so you live a long and healthy life? Yeah, well, that's the goal with all this stuff. But I think the whole concept of cure is really misleading.
Okay, that's very insightful. Thank you. I appreciate that too, because I happen to agree. I'm not in a battle to cure my cancer. I'm in a battle to live a long and healthy life, and that's what we try to preach to people, is that you can't. This is not a 6 or 8 week program. This is a change in your life, and that's what you're trying to implement here at the True North Health Center.
Yeah, we believe health results from healthful living. So the focus is diet, sleep, exercise, and if it's appropriate, fasting.
What are the best tools for people that have been grown up and have to live with a standard American diet to be able to say, my gosh, I've got to change my behavior because I've got this health crisis?
Well, I've noticed that the best motivators for behavioral change are pain, debility, and fear of death. So
that's my
best patients typically have a combination of those. Debilitating pain is fabulous. That'll drive people to do things. They'll even be willing to eat differently or exercise or go to bed on time. You know, it's amazing what people will do if pain is bad enough. The problem with pain is that when the pain goes away, they start deciding they're well again. And it was Mark Twain, a famous American philosopher, that said, denial is not just a river in Egypt. And I think he was thinking about, you know, people trying to make behavioral change. Trying to get people to make behavioral changes is very difficult. It's very hard for people to give up their addictions. It's like, you know, if a person's an alcoholic and you go up and say, you know, your life sucks because you're a drunk, they don't go, it's the alcohol? I had no idea. Oh, thank you so much. I just won't drink anymore. They tell you to mind your own effing business because they don't want to hear about it.
Yeah.
And, you know, if you try to explain to people that what they're putting in their mouth may be affecting their health, it's very difficult for them because all their life they're told diet doesn't matter. If they go to a physician, their diet says, oh, it doesn't matter, eat whatever you want, diet doesn't matter.
Yeah.
If you're a female particularly and you lose a bunch of weight and you go to your doctor doesn't think, oh, good on you, mate. You've adopted a whole plant food diet and begun exercising. They think you probably have colon cancer, or you have developed an eating disorder, or you're a drug addict, or a combination of those. Because the experience is that nobody loses weight and keeps it off unless they're dying of cancer or cachectic disease. They've developed an eating disorder, or they have a drug addiction.
In the last year or two, has there been any really groundbreaking research as far as diet related to cancer? I think we've got a really consistent direct link between diet, heart disease, obesity, certainly diabetes.
Well, I think, you know, Dr. Ornish has been doing some work on prostate cancer in particular and its relationship to diet, and he's published some papers that are interesting. One of the challenges is that it's very difficult to do human research that isolates, you know, specific dietary intervention in free living people. You know, because you have issues of what you're doing, how well you're doing it, measuring it can be a challenge, and particularly in diseases where their natural history is very long, it takes a long time to get meaningful data. So unfortunately, a lot of times choices are driven more philosophically than scientifically. So the science can point us in a direction, it may reinforce over a long time what those conclusions are, but I don't think it's as black and white as sometimes we like to believe.
Yeah. Are there any active research studies being done now on dieting cancer?
Well, there's
not interventional, but certainly prospective.
Yeah, there's all kinds of stuff that's being done around the world, and you can go to Medline and look at it's almost overwhelming just trying to keep up with the current situation. We're fortunate here at the True North Health Center. Our True North Health Foundation is a 501c3 nonprofit research-based organization, and we have a really bright director of research, Tasha Myers, who does a really good job of helping us interpret, what we're seeing as this material becomes available, and helping kind of direct and point us and keep us on track in terms of meaningful research that we're doing here.
Every time we do a training, yesterday, what about keto? I'm on keto, the ketogenic diet. I saw a cancer journal in your lobby that had, I didn't get a chance to read it because we came in here, but it was an update on the ketogenic diet to treat cancer. So how do you feel about the ketogenic diet in general and about treating cancer?
Well, it depends on what you mean too. A lot of people describe ketogenic diet as a wide variety of ways. For example, it may be a paleo type, high protein, high fat diet. I think it's a nightmare, and I think it'll eventually, we'll see in hindsight just how much a problem putting people on high protein diets is. There's also versions of it where there's high fat, low protein, low carbohydrate diets, the fasting mimicking diets. And what they're trying to do is take advantage of the fact that when you go on a ketogenic diet where you're producing ketones rather than burning glucose, there's a hunger blunting mechanism. And honestly, anything you do to help people get rid of dietary excess may have some benefit in terms of improving their health. So compared to a standard American diet, that may work. I believe that the best evidence supports a whole plant food diet as being the diet that is sustainable long-term for the widest number of people with the widest variety of conditions. So we advocate a whole plant food diet, and we recommend getting rid of the chemicals that are being added to food that include sugar, oil, and salt. That these are not actual foods, these are chemical byproducts, and they stimulate a lot of problems. Now people debate now what's worse, is it sugar or salt or oil, or at the True North Health Center we don't have to have that debate because we get rid of all of it. We're feeding people whole foods, plant foods exclusively, so no meat, fish, fowl, eggs, dairy products, oil, salt, or sugar. And what you're left with is a whole natural food diet, and we believe that ends up being around 10 to 12% of calories from protein, about 15 to 18% of calories of fat if you include small amounts of nuts and avocado, fat-rich foods in the diet, and the balance coming from whole plant carbohydrates. And so the advantage to that type of diet, unlike say a diet from 80 or 90% of your carbohydrates coming from refined carbohydrates, where the sugar is balancing your glucose and your insulin levels all over the place, leading to cravings and difficulties and impact on the microflora in the gut, etc. So you have a diet that's rich in soluble fibers, that's designed to feed the 5 pounds of bacteria that live in your gut the foods that they're ideally situated to consume. So your gut gives off nutrients rather than toxic waste like TMAO, etc.
Can you just briefly tell us about, so you've got intermittent fasting, long-term fasting?
Yeah, Walter Longo from USC has pioneered really some publications looking at intermittent fasting as a tool that can be practical for people at home. It also encompasses a wide variety of applications, but one of them would be narrowing the feeding window. So you don't eat before a certain time in the morning. You don't eat after a certain time in the evening, so that you have a period of fasting, 12, 14, maybe 16 hours every day. And even that small amount of fasting is thought to induce metabolic changes that might be helpful at health promotion. In addition, they might limit calories to say 500 or 600 calories once or twice a week on days that you can rest, where you're eating maybe only fruit and vegetables raw for a day or maybe a second day during the week to facilitate additional weight loss. Because remember, dietary excess is responsible for many of these diseases of dietary excess or chronic diseases. So getting rid of the dietary excess, getting rid of the excess weight, giving the body a chance to detoxify is thought to be helpful. So intermittent fasting may be a safe way of bit by bit accumulating these metabolic changes to allow the person to heal itself. What we do at the True North Health Center is a more radical version where you do long-term water-only fasting. I believe that's going to be geometrically more impacting, but the downside is it needs to be done in a medically supervised setting under supervision. So it's not practical for everybody that doesn't have the ability to get some time off or go to a place to do something like that. And for many people, that intermittent fasting is enough to get the changes they need, along with a diligent application of a whole plant food diet, to lose their weight, to lower their blood pressure, to bring their blood sugars down. In fact, now, because people have to often wait 2 or 3 months to get in to the center, our patients that are doing that while they're getting ready to come to fast oftentimes just get well. It's just by the time they're ready to come in, they don't need to come in anymore because they've already accomplished the goal. Other people still need to come in, but they don't need to come as long because they've already made a lot of the progress.
So your focus is whatever type of fasting you're doing, you have to transition to a whole. Obviously, you're not going to experience all the benefits of fasting, or maybe none of them, without leaving behind the standard American grease-filled diet, salt, sugar, and fat, and transitioning to a whole plant-based diet.
Well, yeah, the fasting is just a facilitator to make the diet and lifestyle changes. The fasting without making the necessary diet and lifestyle changes is not going to be effective over the long run. Now, we don't ask people to do it forever, obviously. We just ask them to do it for a limited period of time, 50 years. Once we get a 50-year follow-up, they're free to go back to whatever
I'm signing up for that plan tomorrow morning. But I will say, if you're watching this, the True North Health Center here with Dr. Alan Goldhamer in Santa Rosa, if you're struggling with diabetes, and I know a lot of people are, or any other metabolic type diseases and syndromes, it's worth at least a call and a consultation.
They can actually, if they go onto our website at healthpromoting.com, they can fill out what are called the registration forms, which gets us their medical history, and they can call for a no-cost phone conversation with me to talk about whether there's anything we do that might be of interest or use to them. Also, they'll find on our website all of our articles and studies freely available. They can download those articles. There's a learning channel that has all of the papers. There's something called True North TV, which has all of our video clips. So there's a real information rich website available.
Yeah, and I use your website all the time for putting presentations together for our program, so it's great.
Excellent.
Thank you very much. Appreciate your time.
My pleasure.